options that the Democrats could have brought to the floor to lower health care costs and increase access to care. Such legislation would indeed be worthy of our time. But instead, we are debating expressions that basically amount to political posturing. The first vote the Republicans called this year was a motion to require legislation protecting individuals with pre-existing conditions. Surprisingly, the Democrats voted against that previous question. In 2017, as part of the proposed replacement for the Affordable Care Act, Republicans included legislation that would have preserved access for those with pre-existing conditions. Speaker Pelosi has already intervened on behalf of the House in Texas versus the United States. While the Department of Justice has weighed in, the department is not litigating the case. As with every other legal case, this will play out in the courts. If Congress must act following the final legal decision, certainly we stand ready to do so. In fact, if the Democrats wanted to void this case, they know their options. They could repeal the individual mandate, or they could reinstitute the tax on the individual mandate, or they could provide a severability clause that was somehow left out when the Affordable Care Act was passed the first time. But we've seen them do none of those options. The legal process will take time, and no Americans will lose access to their health care while the legal process is being heard. Unlike the case of Texas versus the United States, which we know will not affect coverage because the judge in that case has issued a stay, individuals covered by what are known as association health plans may actually lose their coverage due to uncertainty in the legal outcome of that case. For last week, a federal judge in the case of the state of New York et al. Versus the Department of Labor, last week a federal judge ruled that the Department of Labor's final rule on association health plans was not legal. Association health plans provide employers who otherwise might struggle to provide health insurance for their employees access to a group market through an association based either on geography or a line of business. The Washington Post recently reported that there are initial signs that association health plans are, quoting here, offering generous benefits and premiums lower than can be found in the Obamacare marketplaces, close quote. Association health plans have provided additional choices for Americans seeking innovative health care options, but these choices may soon disappear as a result of the lawsuit State of New York et al. Versus Department of Labor. The Democrats are using the case of Texas versus the United States to delay explaining their real ideas. Their real idea is a one-size-fits-all health care. The so-called Medicare for all would be a terrifying reality for our nation. The Democrats' Soviet-style government-run single-payer health care bill would not provide access to quality health care for Americans. Instead, it would lead to a massive tax increase, eliminate private insurance, and bankrupt the already dwindling Medicare trust fund. Constituents in my district back in Texas are struggling to afford their health insurance under the Affordable Care Act, and I'm certain that we are not the only ones suffering from high premiums and very high deductibles. What good is health insurance if you are afraid to use it because you can't afford your deductible? This is an issue that I would actually like to see us tackle, but I am confident that a government-run single-payer system would only further deteriorate our nation's health care. I'm the son of a physician who chose to leave Canada because of their system of socialized medicine. I worry that the central state control of health care would further damage the doctor-patient relationship. As a physician, I do not believe that the government should hinder a doctor's ability to act in the best interest of his or her patient. I wish the concept of government dictating a physician's practice and decisions was unthinkable, but I find myself here today having to deconstruct the idea of further government control of health care. The House Democratic proposal would implement a global budget, and once that has been set, hospitals and institutions would be required to stick to that for all outpatient and inpatient treatment. What happens if the budget runs out? Are the patients simply told, sorry, we ran out of money, you may try again next year? Today, we should be focusing on the parts of the health insurance market that are working for Americans. For example, 71% of Americans are satisfied with their employer-sponsored health insurance. This provides robust protections for individuals with pre-existing conditions under ERISA law, a 1970 law, not the 2010 Affordable Care Act. Quite simply, the success of employer-sponsored insurance is not worth wiping out for single-payer health care. Since President Trump took office, and this is important, since the president took office, the number of Americans in employer-sponsored health coverage has increased. How much has that increased? I can't precisely tell you because our congressional budget folks have not seen fit to give us new coverage numbers. But since the president took office, how many people are employed that were previously unemployed? The number is somewhere between 3 and 6 million, and a significant number of those individuals have employer-sponsored health insurance that had no insurance before. So the coverage numbers under President Trump, if the story is ever told, those numbers have gone up. Today, there is a greater percentage of Americans in employer-sponsored health coverage than at any time since the year 2000. That's why it is astonishing that House Democrats would want to abolish that insurance option entirely. Instead of building on the success of our existing health insurance framework, Democrats' radical single-payer government-run policy would simply tear it down. It would eliminate employer-sponsored health insurance, eliminate all private insurance, eliminate Medicaid, eliminate CHIP. Existing Medicare beneficiaries would not be exempt from harm, as the policy would raid the Medicare Trust Fund, which is already slated to go bankrupt in 2026. Our nation's seniors count on the existence of Medicare for their retirement health care needs. They have paid into it their entire working lives. How are we supposed to inform them that not only do the Democrats want to endanger their access to Medicare services, but unbelievably, they will want to increase their taxes also? There is no question that this policy could be catastrophic for America's patients today and for generations to come. Under this policy, at least now there's some degree of honesty. Remember, a previous administration said if you like your doctor, you can keep your doctor. Now at least there's some degree of honesty. You can't keep your doctor. You can't keep your insurance. You can't keep your personal liberty. You get nothing. It is effectively would end all of the parts of our healthcare system that are in fact working for the American people. Quite simply, single-payer health care would be another attempt at a one-size-fits-all approach to health care. And we know this. Americans are all different. A universal health care plan will not meet the varying needs of each and every one of us as individuals. Single-payer is not one-size-fits-all. It's really one-size-fits-no-one. So again, to restate the obvious, since the beginning of this Congress, you've heard it. Through the last Congress, you heard it. Republicans support protections for individuals with pre-existing conditions. Instead of spending our time here today worrying about the judicial branch, we could focus on our job as members of the legislative branch. We should be actively working to better our healthcare system, not to spend time taking votes that will fail to accomplish any real objective.